Assalamu alaikum wa rahmatullahi wa barakatuhu. Our brothers and sisters in Memphis, welcome to this unique and special seminar this evening. Today, we are running this special seminar as a collaborative effort between the Islamic Association of Greater Memphis, Masjid al-Rahman and Masjid al-Nur, and our beloved Masjid MIC, Memphis Islamic Center. My name is Hassan Al-Muaddin, and I'm co-hosting this interesting seminar today with my brother, Dr. Ibrahim Sultan Ali. Dr. Ibrahim Sultan, Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. We hope and pray that you are doing well and in good spirit, and we really welcome this magnificent opportunity. We are delighted to work together with Masjid al-Rahman, Masjid al-Nur on this event, and we are really glad to have our beloved Memphian brother, Dr. Ali, back in Memphis. And I want to thank Dr. Al-Mazin for spearheading this effort bringing Dr. Ali back to Memphis, inshallah. So I'll let Dr. Al-Mazin do the introduction for our guest, and then inshallah we'll start the program. Dr. Al-Mazin.
Thank you, Dr. Ibrahim. I appreciate it so much. Thank you. Our guest today, Dr. Ali Ellebedy. Dr. Ali earned his PhD in Virology Immunology from the Joint Program of Integrated Biomedical Sciences at UT Health Science Center and St. Jude Children's Research Hospital. After earning his PhD, he went to pursue a postdoctoral fellowship at Emory University School of Medicine, and then he joined Washington University in St. Louis, Missouri as a faculty. Dr. Ali was very successful. He became associate professor with tenure, and he became an expert in the area of virus research. Dr. Ali Ellebedy, when COVID-19 became an epidemic, a general epidemic, Dr. Ali was working diligently on this area of research, and his research was recently published in very prestigious journals, Nature, and which caught the attention of many media outlets. Recently, he was on CNN and Al Jazeera talking about his research. Many of us in the community were thrilled to see Dr. Ali and his success. We asked Dr. Ali to join the community here in Memphis and come and give a seminar to our community. And here he is. Dr. Ali, Assalamu alaikum.
Alaikum salam wa rahmatullahi wa barakatuh.
Thank you for joining us.
Thank you for having me, and it's a pleasure to be here. And thank you for the invitation. And it's always a pleasure to come back to Memphis. This is home.
Thank you so much, Dr. Sultan and I were happy that you were able to join us today in this webinar. And so we want to invite you first, if you want to share with us a little bit about the research you've been doing, so our viewers can understand how the virus, when the virus hits the body, what happens, how the body develops immunity, and then we'll go into more details about the vaccine and COVID-19.
Absolutely, it will be my pleasure. So I will start sharing. Okay, so I'll just talk in the first few minutes, maybe 10-15 minutes, just to give you an overview of our knowledge so far about vaccines and immunity to vaccines. There are some historical perspective in the first few minutes, but then I will talk specifically in general about vaccines and then specifically about COVID-19. So as I said, it's a pleasure to be back in Memphis. This is truly home for me, and coming back here always brings lots of great memories. So I'll start first by showing something that I assume that many of you have really probably heard the story about the very first vaccine. This is the smallpox vaccine. This is a virus that was really a huge problem a few hundred years ago, and remained a huge problem until the virus was eradicated totally. And eradicated because of really the invention of vaccines. So the point I want to show you here is that vaccines have, since the beginning, more than 200 years ago, vaccines have been one of the major accomplishments of the human race, basically, to overcome lots of diseases. So the next slide that I'm going to show you an image that some can find a bit graphic, but it's really a very strong image that I think it's very important for us to know the impact of vaccination. So I just give you the warning now, so you're ready for this. So what you're looking at are two 13-year-old kids that were, their pictures was taken in 120 years ago in Leicester Isolation Hospital in the UK. The difference between these two kids, they are both the same age. The only difference is one of them got the vaccine with the way that I showed you in the first slide when he was born. And you can obviously tell who got the vaccine. This is the smallpox. This is the virus that through vaccination, we managed to eradicate. This tells you how impactful vaccination is. And thankfully, we don't have that virus anymore. So now that we know how important vaccination is, let's talk about, or another example that should be more familiar. Sorry, I should have mentioned. Another example should be more familiar to you is the polio. This is how poliovirus, the wild poliovirus, this is what caused the paralysis, and you have seen this. This is the wild poliovirus. You can see it throughout whole Africa and Asia and some parts of Latin America. But now, 20 years later, after a global investment in vaccines, this is what you see. And this is even right now, India is free and Africa is free. And there are only very small pockets that still have the polioviruses and the wild type. And that's really, that tells you how impactful vaccination can be. So now that we understand why vaccination is important, how successful vaccines were really in our, to really preserve us, to preserve our human race. So now we can talk about the kinds of vaccines. And I know that this is something that a lot of people are wondering about. So all the vaccines, like the successful examples that I mentioned earlier, they are really made from very traditional way. Basically, you either take the virus or the bacteria and they're just inactivated, or you take a piece of it and use that as your way to introduce it to the body. And in all of these methods, and there have been many, many successful examples, the measles, mumps, and rubella, this is the MMR. This is a very successful vaccine. Hepatitis A, this is also very rabies. This saves a lots of lives. You know, rabies infection is basically, there is no, it's fatal. And we just heard about a couple of weeks ago, a case in Missouri where a person got bitten by a rat and by a bat, and just they refused the treatment. And there is really no way out from that one. Once you develop symptoms, there is no way back. It's 100% fatal. So lots of vaccines saved millions of lives over the last 120 years, or over the last 120 years since we have vaccination programs became very available. So what's the difference between these vaccines and the kinds of vaccines we see with COVID-19? So those vaccines that I'm showing you, you give our body a piece of protein or the whole virus or the whole bacteria, but just inactivated. But in all of them, we require that we bring a piece of protein to the body. And that requires a lot of work because you need to make sure, first you want to be able to mass produce that, but also make sure that it's a quality, it's clean product that you can inject into people without causing any problem. And that takes time to develop, but also takes time to distribute and to produce. So that has been the problem with us. And that's the problem. It's good for stuff that you can actually, for vaccines or diseases, that you really don't have to be running against time. There is not in the case of pandemic. So that's why we have seen more recently, more novel platforms for vaccines, something like the RNA or the DNA, or something like the recombinant protein that like the J&J Johnson & Johnson vaccine is using. So those basically non-traditional platforms, what they do is they do the same exact job, which is deliver a piece of protein, but instead of just giving the protein, we are giving our body really the message that you need to make this foreign protein to our own cells And these proteins now will be dealt with by our immune system. So instead of us making these proteins outside of our bodies and then deliver it as vaccines, and that's basically what's all of these kind of vaccines are, or the recombinant proteins, we are actually giving the body the message. The advantage of that is that we don't have to be slow in terms of mass producing the vaccine or distributing it as we have seen. So any vaccine has to go through, to be approved by the FDA, has to go through what we call phase 1, phase 2, and phase 3 trials. And you might have heard about this in the news, about phase 1. So these different phases, as you can obviously see, involve different number of people, participants that are volunteers that participate in each of these phases. And you can see that they are actually ascending, increasing number of people. And the very first one, we just test the safety of the vaccine. The second one, we start to learn more about, first increase the number of people, so we learn more about safety, but also learn more about how immunogenic that vaccine is. And the last phase, and that's the most important, this is where we include 30,000 people and give them either placebo or give them the control vaccine or the real vaccine. And now we see how effective this vaccine is. And that's the most important. So what you can do if you really need the vaccine as soon as possible, you can actually merge phase 1 and phase 2 together and learn as you go about the safety, but also about the immunogenicity. But then you start the very critical phase 3 as soon as possible. And this is what happened with the COVID-19. We started phase 3 as soon as possible. As soon as we got the first signs that this vaccine is relatively safe, and I'm talking about the mRNA vaccines, relatively safe and effective, and have some immunogenicity that can be promising. And then take that to phase 3 right away. Phase 3, usually 20,000 people. In case of mRNA vaccines and Johnson & Johnson, it was done between 30,000 and 40,000 people were included. So this is actually, we did not cut corner in phase 3 trials. So many people ask, what's the difference? Why we usually takes years in previous vaccines, but we only take a year or less with the COVID-19. So it takes years because you need a lot of work beforehand. You do it in animal models to make sure that you have a candidate vaccine. That's first. Then you take, if you don't have a rush, you take your time with phase 1. You don't really, and then after you finish phase 1, you start analyzing and then go to phase 2. And all of this, really, just because there is no urgency, we take these times. But then the most important is phase 3. So what happened with COVID-19, we were lucky in a way. We were lucky because we have a virus that's very similar to COVID-19, that's SARS-1, which was an outbreak in 2002, but also we have the MERS virus, which is the Middle Eastern respiratory syndrome. And that virus was just 2012 that we started to emerge. So we had a heads up with some of these coronavirus-related candidates that we already did the preclinical work. And we have some candidate vaccines, including mRNA-based vaccines, that were already tested. So now we cut all of the first part, which is the part that really requires a lot of time. Because of that, we are lucky with this experience that we had in the last 20 years with coronaviruses. Then we merged phase 1 and phase 2 and quickly started phase 3 with, again, 30,000 people for each of those vaccine manufacturers. And then we got the emergency authorization. So there's really, I know it happened in a fast time, in a very fast track, but it doesn't mean that we really didn't test the safety. And remember, safety is always being tested, even after the vaccine was rolled out. And for the RNA vaccines, there's 200 million people in the US received RNA vaccines, approximately 200 million people. So if you are not capturing major side effects, this is very, very safe vaccine. And of course, worldwide, there are already half of the world population received either 1 or 2 doses. So we know that lots of people got the vaccine. So how vaccines in general work? So as I told you, you need to give the body something like foreign, that the body would recognize that this doesn't look right. So you either give it like as a already made protein, and these are all the traditional vaccines, or you give it to them as a message, which is an RNA or DNA, and allow our own cells to make that foreign protein, and then our immune system can recognize that. And the main job of our immune system is to produce these protective molecules. We call them antibodies. You heard in the news about antibody tests and all of that. These are the major molecules that we use, our immune system use to block viral infections. Very, very important molecules. And the way these molecules, first let's start about RNA vaccines actually, because I know there's a lot of questions about how these vaccines work. So what happens is if we actually identify that the spike protein on the surface of the virus has a lot of proteins, but the spike protein is very critical, as I'm going to show you in the next couple of slides, very critical for the virus to get inside our own cells. So what we do is we take the sequence of RNA that's responsible for generating the spike protein, and we put it into these lipid molecules. And that's basically the RNA vaccine. And when we inject this into our own muscles, our muscle cells will take that message, will take this message and will make the protein like what it makes. We make these proteins every second.
So Dr. Ali, can I interrupt you here for 1 second?
Please go ahead.
You mentioned a lot of parts of the vaccine and a lot of parts for the virus. So help our viewers understand when you say the spike protein, what are you specifically referring to so people can understand this specific unique protein?
Yes, so viruses in general need to have a protein on its surface that allows that virus to enter our own cells. The viruses cannot start replication or cannot start their life cycle unless they get inside the cell. And to get inside the cell, they need like a key. And that key, and for the coronavirus, is called spike protein. It protrudes outside the virus, as we can see here. And that's the key protein for the virus to get entry to our own cells. And very important for our immune system to prevent that step. And to prevent that step, we need to make antibodies that can recognize that key and lock it before the virus can even attach itself to our own cells, so it doesn't get inside and start its life cycle. And that's how you protect against many, many other viral infections. And COVID-19 or SARS-CoV-2 is not really exception in that case. The major point here, I want to make it clear that the RNA that's being injected into our muscles as a vaccine does not get into our nucleus. Why this is important? Our nucleus in the cells, this is the place where our DNA is. And many people have heard misinformation about that our RNA can actually integrate, the RNA vaccine can integrate into our own DNA. And this is not the case. RNAs do not go inside the nucleus. Everything about producing that protein happen outside of the nucleus. This is how normally we make proteins every single second. Our cells makes proteins. So this is, once our muscle cell make the protein, it will produce that spike protein on the surface. And now our immune system will recognize this is a foreign protein that needs to be attacked and make antibodies against. And that's how RNA vaccines work. Extremely efficient, very immunogenic, produce a lot of antibodies. And as you can see, it has very effective against severe infection.
So Dr. Ali, so basically what you are telling our viewers is this mRNA vaccine developed by Pfizer and developed by Moderna and injected into the muscles gets into the cells, but does not touch the nucleus, does not get anywhere into the nucleus, just go and begin to prepare a protein. And this protein, as you indicated, is what sits on the cell. And then the immune cell begin to recognize this protein as the virus, right? And then begin to bind to this virus. So when people say, oh, it's going to change my genetic information, it's going to cause sterility, it's going to cause, so this is nonsense, right?
This is not the case at all, because it doesn't get inside our nucleus. It doesn't integrate itself in any way. And then the other thing now is how, just I mentioned to you, how antibodies in general work. The virus needs to attach to the cell and needs to get inside to start its cycle. Antibodies are the most efficient way to block that by binding to the virus, especially binding to something like the spike protein on surface of COVID-19 virus, and then can block it from getting inside. And that allows us to block the life cycle of the virus.
Dr. Ali, stay that slide. This is really, really important. This is what we want our audience to understand. When you are infected by virus, right? As you show in the first slide, the virus attached to the cell, right? And injects the whole virus into the cell. I just want to make sure everybody understands that's what you're showing.
Correct.
The cell with all its mRNA, with all its protein, with everything is injected into the cell.
Correct.
And then takes over the cell and produces it. So we were saying the vaccine is going to inject a little bit of mRNA, not the whole cell, right?
Yes.
So this is what I want people to understand. The virus, when you get infected, it injects its whole mRNA into your cells.
Absolutely. And
make that more clear.
Infection is where the virus not only comes with just a piece of it, the whole virus goes inside the cell and start the replication and start its life cycle. And that's the problem, because when a cell get injected or get infected with a virus, millions and billions of those viruses will come out of it and infect all the other cells, neighboring cells. And that's why the deterioration happens very fast, because the process happens so fast, and all of the cells get infected very fast. And that's what causes the pneumonia that we see in the lung, because all the lung cells gets infected. And that's the vaccines are the best way to prevent that. You can think about treatment, but it's always say the treatment is the best treatment against infections is to prevent the infection. And that's what antibodies produced by vaccines are meant to do.
Dr. Ali, I have a question here. So many people raise this question that when the mRNA goes into the cell and begin to make this protein that mimic the spike protein on the surface of the virus, that this protein actually has some negative effects, and this protein may cause a problem. So help our viewers understand that this protein doesn't have a function, a negative function that can cause problems for people. And this protein, if it doesn't generate antibodies, is going to be eliminated from the body and will not cause harm to the body.
So that's a great point. Remember that the RNA that we inject is limited amount. So when you inject a small amount of RNA, like the vaccine does, you only generate a small amount of the protein. And that amount is enough for our immune system to recognize that this is something foreign that needs to be handled and antibodies needs to be generated. And that's what happens with vaccination. The problem now is if you get infected with the real virus, you are actually being exposed to the same protein, but now in uncontrolled fashion, because now the virus now can replicate and can increase its, go unperturbed in its life cycle, and now generate billions of copies of this. And that means that the protein that you're worried about from the vaccine, you have millions of folds more from the infection. So if that protein, if that small amount of the vaccine could be, if there is any harm from it, the infection itself is giving you more than that. And that's the thing that you should really be aware of. At least with vaccines, we are giving a controlled amount, and there is no study has been shown, nothing has been shown so far, nothing credible that's shown that this protein has any long-term effect or side effects, other than being a foreign protein that our immune system handles, like it handles all the foreign proteins we get exposed to on a daily basis. We get exposed to many viruses every day. And if you have kids that goes to daycare, you get exposed to a lot more. And our immune system handles everything for the same way. If this doesn't belong to the body, it needs to be removed. And this protein doesn't belong to the body. It's a viral protein, and that needs to be removed. And that's what the vaccine is, a way to teach our immune system to recognize this foreign protein. So when you get exposed to the real virus, our immune system is not naive. This is not new to them. Our immune system recognizes this is a danger and it needs to be handled, and it being handled quickly. So,
Dr. Ali, before we move on to another point, I have another question on this point. Many people consider, I don't want to take the vaccine. I don't want to expose my body to synthetic materials. I prefer to get infected with the vaccine and develop natural immunity. What message do you have for people who say something like this?
Well, that's a point we hear a lot in the news, and we hear a lot from people, unfortunately. So the problem that is, it always reminds me of basically you are gambling, and if you're doing this, you're not only gambling with your own life or health, you're gambling with also people around you or exposing them to risk. So when you get infected, there are many different ways. Every one of us is different. Every one of us has different have different healthy immune systems. So some of us have more healthy than others, and every one of us will handle this virus differently in terms of immune system, because you could feel, oh, I just got a minor cold, but someone was almost everything like you, almost, but obviously genetically different, will handle it very differently and can be severely sick with the exact amount of viruses being introduced. And that's a problem. Yes, you can, if you handle the virus, yes, your body will develop a natural immunity, or what we call natural immunity. But the problem, what's the price for that? The price for that is you will get sick. Sometimes we have seen this with even up to 30 to 40% of people, even in people that didn't get severely sick, develop long-term consequences that make them have some side effects that even after the long time after the virus is gone, they still have this. Talk to people will tell you that we have this. I mean, it's never the same. It's the cloudiness in the thinking and the fatigue, the quick fatigue, and they will tell you they are never the same, and it takes months and months, and some people even a year later they still suffer from the same problem. So why gamble? Why if we have a safe way for you to a controlled way for you to develop this protective immunity that has been injected in billions of people at this moment?
You know, brother Dr. Ali, maybe we can ask Dr. Ibrahim, because he sees a lot of patients, COVID patients at the hospital. And maybe Dr. Ibrahim can shed some light on the patients you see at the hospital. How many of them are vaccinated in the hospital? How many non-vaccinated?
Number one, I want to emphasize what Dr. Ali said. Even as today, when I was driving back from the hospital, I was called by one of my relatives, uncle, who had COVID-19 in the area, in New York area, so early surge of COVID-19, and he had a mild case. He never went into the hospital, but still this today, he's dealing with fatigue, chronic fatigue. Okay, so this disease is real, it kills, and also even those what we call long haulers right now, it is real, even if they have a mild. Even the children right now are maybe developing. So this is really something that we are seeing it every single day. That's number one. Number two, we are seeing in the hospital right now those people who took the chance and say, let me get the regular way immunity. More than 90%, 95% of the people who are in our ICU is people who are not vaccinated. Unfortunately, when they get that sick, somehow the light goes in their head. I said, I wish I had done this first. And then they call everybody in their family and they say, please get this vaccinated. But that is kind of almost like, it almost reminds me as a Muslims, as we believe, you know, when Fir'aun was crossing the sea and he's saying, now I believe they Allah most, and it's too late. That's what I seen that in my own eyes. I witnessed that in the day of judgment, that the people who are now about to go on ventilators and then calling their family say, please, don't do what I did. Please go get vaccinated. So this is a really, we consider this is a blessing from Allah that we get this vaccine. That is Allah, that we can get safe immunity. So yes, so we're seeing both of the consequence of the long haulers, even if those who have a mild disease, both adult and kids. Okay, and we do not know how to treat them. That's what I'm trying to say. My uncle right now, more than 1 year, is just fatigued and he cannot function. Okay, and also we're seeing the people who have acute in the ICU are dying. So yeah, what do you say?
Yeah, I've heard many stories about people not regaining their taste of smell, sense of smell, sense of taste, and it's a lot of things that you don't, things that we take for granted, that we really do every day and we don't think about it, but once it's gone and we just worry about it, and I feel like it's a really unnecessary risk that you take. But also, more importantly, you expose everyone around you. And some people around you might not, even if you're the most healthy and you have the perfect lifestyle, you have the perfect body, you have everything that allows you to think, oh, it will be a mild case for me. But it doesn't mean that you're not transmitting the virus, because the virus replicates, especially the Delta variant. It replicates very fast and it achieves really high level in the nose. And then, you
So
sneeze
Dr.
around
Ali,
and you cause a problem.
when we talk about the Delta variant, Dr. Ali, help our viewers understand what's the difference between the original virus and the variant. What is the change?
So the main change that we have seen so far with the Delta variants, and even the Delta variants, there are many variants of it as we speak, there are more emerging. The main change is the virus acquired an ability to replicate more efficiency, and meaning the process that you are seeing right now, the virus is doing it faster than the original one. And that means is that now, remember, it's in all our cases, it's a race between our immune system. Any infection is a race between our immune system and the pathogen, whether it's a virus or bacteria. And if the virus acquires an ability to actually replicate fast, that's a huge advantage in that case. And that's the problem, because now for people that have no vaccination, you're already behind because the virus already replicates fast. But now with the Delta variant, you are really behind, because now you have a virus that acquired an ability to, instead of producing, and this is an example, 10 copies of itself in 5 minutes, this becomes 100 copies in 5 minutes. And now, even if you are mounting this natural immune system that you are depending on, you might be overwhelmed, or your body might be overwhelmed before you have enough antibodies to actually limit the replication. And remember, it happens very fast. So you really need to produce antibodies very fast. And I really would like to mention this, because this is the virus starts to get inside our cells. And this is the best time here. Here is the best time to stop this process, because it's a very fast process. Get antibodies, so the antibodies have it preformed, ready to go. And those antibodies, as I'm showing you here, this is the spike protein that we discussed. This is the main protein on the surface of the virus that the RNA vaccine or the Johnson & Johnson vaccine is basically allowing our cells to make that protein. But the rest of the virus, we don't see it in the vaccine. So there is no way that anyone will get an infection from the vaccine. This is absolutely not a chance, because we are only see the whole virus. We are only injecting you, or the vaccine is only containing that protein on the surface. Remember, the virus have many proteins, and those proteins are important for the virus to copy itself, copy its genome, and even for the whole integrity of the whole protein. All these proteins on the surface are needed, but the vaccine does not provide any of this. Only thing the vaccine provides is this red protein, the spike. So there is no way, when you hear someone tells you that the vaccine can cause the infection, you tell them there is actually absolutely no evidence of that, and scientifically it's not possible, because we are not giving in the vaccine any of the component except one protein of that virus.
So thank you for cleaning this point well.
The vaccine allows you to produce antibodies that prevent virus going into your cells and getting all the virus and all its mRNA and all of this. This is what Dr. Ali is showing us. So if you're thinking that little mRNA, the vaccine is injecting to my cell is a problematic, just imagine the virus is injecting everything into your cells. I want to make sure everybody understand that. So then they take over and produce millions and millions. And also understand, or those of you who have children, you understand that your children is a little bit different, one from different than another. The virus is producing millions of children. So some of them will be a little bit different than the others. And the immunity might not catch them, I may escape. And when that ones escape, then they become the dominant and they overtook. So our biggest fear is that during this replication process will become a variant or something related to the coronavirus, but that the immunity does not recognize, or the vaccines does not recognize, because they, as I said, if you have a child, they're all different. But when you have millions of children, there's a chance that you get completely like different one. So if you get that one and the immunity doesn't recognize, it is a setup for suicide. That's why we are screaming about, let's get the vaccine as soon as possible before that emerges.
So Dr. Ali, before you move forward, we have a questions on, remember the CDC a few months ago announced that with the variant, people already who are vaccinated can carry this variant, the Delta variant and other variants, and they can also transmit. So obviously, there's a change in the protein, the spike protein. And although we have developed immunity against the original virus, but this new variant basically can still penetrate the biological fluids in the body, can still replicate, can cause a little of harm to people who were vaccinated. And many people got sick with this Delta variant after they got vaccinated. So if you can speak a little bit about this. Please.
So the point here is, remember about the race. So even if you are vaccinated and you have some antibodies already, the virus comes, remember, you have antibodies distributed all over your body. And it's not concentrated in your nose where the virus most likely came in. They are distributed all over. So there are some antibodies exist in your nose that came from the vaccine, but not a lot of them because they are all over your body. So what happens is that you get exposed to a large dose, meaning that you are sitting in a family setting or close setting with someone who is spreading a lot of virus particles. So you get a lot of viruses in your system, and your initial first line of defense, which is these antibodies that you made, especially in the race against a virus that replicates very fast, will lose the race in the beginning. And that's why people call breakthrough infections. Basically, they lost the first round, which is the very first round because the virus quickly replicates. But what happens is that we have a memory cell that quickly, because of that vaccination, quickly ramps up the production of antibodies. And now we have enough to prevent the progression of those initial invaders to our lungs, which is the most critical part. Think about this. The people who are dying mostly die of the pneumonia. And this is meaning the virus not only replicated in the upper part of our respiratory tract, but the virus went in and there's no resistance. So it went all the way down to the lungs. And this is when the problems really start. This is why people need to be on ventilators, because of the too much damage in the lung. What happens is with people vaccinated, even if they get infected with the Delta variant, what happens is that we have, yes, we could lose the first round, but we have a lot of memory that quickly fires up and ram the production of all these antibodies. And now we fight the virus back. And that's why their infection is mostly mild. The problem now is that that person tested positive because the virus replicated in the lung and potentially could have distributed some virus or transmitted some virus to a different person. And that's why we always say, even if you are vaccinated, just to be on the safe side, still wear the mask as much as possible, because that will prevent, even if you get a mild infection, mild cold, that you didn't even feel it, the chances of you transmitting the viruses becomes very minimal when you're wearing the mask. And now you are not only protecting yourself by being vaccinated person, but also decreasing the chances of transmitting the virus to someone else who has, for some reason, a weakened immune system.
Thank you, Dr. Ali. Can you shed some light on the different type of cells that Allah subhanahu wa ta'ala created for this immune system, and how these different cells work and generate the antibodies, so people can be comfortable that our own immune system is designed to fight, and why the vaccine is another tool to help and support our immune system?
So there are many different immune cells that in our system that are actually designed to make or make sure that we are protected. The cells that make these antibodies are only one kind of this. And the reason we are focusing on them, because it's very clear their contribution to preventing infection. There's another kind of immune cells that they do not produce antibodies, but what they do is think of them as our neighborhood cleaners. They will, once you're a cell infected with a virus in our lung, that cell now, we lost it. But the problem now is if we keep that cell around and we keep it live, that cell will always be a factory for more viruses. So we have a special kind of immune cells that also the vaccine can induce and make them as memory, called T cells. And those cells will go and basically go over and walk over our cells one by one and make sure that if the virus inside, we kill these cells, we kill our own cell to make sure that that factory doesn't operate and no more viruses coming out. And this is just another kind of cells. There are so many different kinds of immune cells that handles invading pathogens. And this is how we managed to really counter the attack of many of pathogens over over the years. And that's very important to learn.
Dr. Ali, thank you. So vaccine, does it only triggers the antibodies part of the immune system, or does it triggers the whole in cascade versus, let's say, natural immunity might trigger all cascade? Can you?
So far what we have seen in the data telling us that by infection, you can induce these, we call B cells, the cells responsible for making the antibodies, but also T cells. And these are the cells that I just mentioned, can clean, basically, or clear infected cells. Vaccine can induce both of those kinds of cells very efficiently. And one thing that I want to make very clear, and this is a very good time to transition for this, is that even if you people look at antibodies as, oh, my antibody levels are decreasing, or this is normal. I want to make sure that people understand how our immune system function. Is that when you are getting first immunized or infected, you need a lot of antibodies in the beginning. These antibodies are important to neutralize the virus, to actually clear the invasion. But then your immune system is not a really good investment to keep making these antibodies because the virus now is cleared and you are good. What the immune system does is actually produce something called immunological memory. This is basically, we learned how this virus looks like. So let's dedicate some of our own immune cells to be trained to know the shape or the feature of this virus. So if you get exposed to that, you quickly ramp the production of antibodies. You don't need to wait for a few days. It becomes a matter of hours where you get quickly recognized. And that's the difference. Remember, it's a race. So having memory cells gains you a lot of time, a lot of advantage in that race. And that's why immunological memory is very critical. And this memory is, we have seen by the vaccination that are very persistent and can be up for 8 or 9 months, are very clear and very strong, robust memory. So having that memory, even if you have very few antibodies in your system, once vaccinated, you have the memory, and that's what counts.
This is
so Dr. Ali, I have a question, if I may.
On Allah, made our systems that the body does not invest so much energy and effort to maintain high levels of antibodies if you don't have the infection around. But it just has a little bit of alarm system, so to speak, memory cells. So as soon as the alarm goes off,
Absolutely.
and it ramps up. So this is an amazing, I think, immunity. Go on and complete.
No, that's exactly the point, is that really having that immunological memory allows us to remember even infections from childhood. You remember, if you get infected with the measles virus where you're young, even if you didn't get the vaccine, where I came from, we got the infection before we got the vaccine. And that's actually, I still have that immunological memory living with me till now, many years later, that I depend on this memory to protect me against occasional exposure to many viruses, as you do the same, and everyone is the same. So this memory is very critical. And vaccination induces this memory very nicely. Infection does too. But then we'll go back to and say infection is the risk that you are taking. If you can do this with a controlled vaccination, it's always better. Dr. Hassan, you wanted to ask a question?
So Dr. Ali, my next question is, we understand now this memory that is retained for the virus. And recently, there was discussion at the FDA about the booster shot. And the panel only recommended the booster shot for people above the age of 65. So help our viewers understand, why did they decide to go and approve the booster shot for the elderly, but not below the age of 65?
So this is a very important point. when our immune system, like anything else in our body, when we age, the efficiency of many of the biological processes, like immunity, developing this immunity, takes a hit, like many other things. And that's why we, for our in the elderly, when you are 65 and older, your ability to handle vaccination or respond to vaccination becomes a little bit compromised, and that is why when you immunize someone, you cannot just deal with everyone immunized the same. You have to take into account how their age, their health status, their drugs they are taking, the other medications they are taking, and all of these interventions or factors play a role in how robust the immune system they will induce against that, even if they are taking the same vaccine. So what the FDA and what was very clear is that the elderly population, and this is not only for COVID vaccines, for all vaccines, flu vaccines, for all the vaccines. That's why flu vaccines, the elderly take a higher dose. There is a special vaccine for the elderly that's higher dose than the regular vaccine, because we want to make a stronger stimulation for the immune system. And that's what's happening here. We just realized that we need to give them a higher level of protection, and add to that we already learned from early in the pandemic that this virus specifically target this population, or at least this population is specifically vulnerable when it comes to handling this virus. So it's important for us to make sure that they have enough first line of antibody as a first line of protection. And that's why the recommendation, and I completely agree with it. So I have to make one important point that I keep people ask about, which was really related here: how we decide and how many doses we need for any vaccine. Really, the decision comes from learning over the years. Actually, takes years to learn how much immunity we need to get protected. So we know, for example, I mean, many of you know that if you take the tetanus vaccine, you need to be boosted every 10 years or so. Did you ever ask yourself how this 10 years were decided or determined? The reason is that we know how much antibodies that you need to have, or the person needs to have, to be protected against exposure to the tetanus toxoid, or the toxin of the tetanus protein, of the tetanus bacteria. So if you need to be protected, you need this amount of antibodies. And through studies over the years, we learned that your immune system will slowly wane. And in average of 10 years, you will have less than this required level of antibodies. And that's why we determined that, or we decided that you need a booster every 10 years. Right now, we all have to acknowledge that we are in the middle of the pandemic. And hopefully we are at the later stage of it, but we are still living through it. So there is a lot of uncertainties about what exactly, we don't know exactly how much antibodies me and you and everyone will need to be protected, especially if we are handling a virus that's not static, the virus that's changing itself. So if the virus is changing itself, so even the level of immunity will change that's required for protection will change depending on how different the latest version of the virus from the very first version that we used to make the vaccine. So that's a very critical point. And that is why it's always will be a moving process. Is we cannot just decide you need a dose, 1 injection, 2 injections, and 3 injections. Again, it all depends on where the virus at and where is our immune system at. And it's all has to be done basically in real time. And that's the challenge here. So it doesn't mean that if a third dose is being recommended or a third injection, it doesn't mean that the 2 injections before didn't work. Actually, they worked really good. The question is, the virus produced a variant called Delta that made us really scratch our heads and think about, well, what else could come after that? And do we need to just add one more level of protection? And that third dose, it doesn't really hurt, because what it does, it builds on what we have before. It builds on the memory that we produce after the first 2 injections, for example, for the RNA vaccines. So it doesn't hurt. So that's why, for example, you heard about the potential to be a third dose. When people ask, oh, is it going to be every year? We don't know that. But again, it all depends on where the virus goes. And the longer we let, as Dr. Brahim mentioned, the longer we let the virus to circulate around, basically the more chances the virus will have to actually mutate and change itself. And that prolongs the whole process. So expanding vaccination and making sure not only we here in the US are vaccinated, but also people in Africa, people in places where minimal vaccination is happening. Because as we all witnessed in the last couple of years, there are no walls and there's nothing can restrain a virus from traveling across the globe. And this is something the lesson should be learned very clearly, that a Delta variant that first emerged in India is now all over the globe. A virus that emerged in South Africa a few months ago, also all over the globe. A virus emerged in Brazil, also will affect all of us. So there is really no borders. There's nothing against viruses. Viruses don't recognize borders.
You cannot build walls against the virus.
Unfortunately, you can't.
Even if it's that big tall iron.
Even the islands in our planet, which are doing great job, like New Zealand and Australia, still they have virus going through.
Dr. Ali, as a physician, practicing physician, without a doubt, vaccines are the best development of medicine. We normally like to, keep people healthy, and vaccines allow us to keep people healthy. When people come us with a disease, they are already sick, and we are just trying to get them better. But vaccines allow us to eliminate the childhood diseases. Like even when I came here in the United States as a pediatrician, when I was doing it, we used to have a lot of otitis media. Mm-hmm. We don't have that anymore. We don't have a meningitis anymore. So, preventing a disease is far better, and you don't have all the sequelae and the complications with that. So, preventing a disease is quite amazingly better than treating a disease. I want people understand this. Preventing a disease is better 100 times. So if you can prevent yourself getting a disease, preventing your family getting, your community, even if you are reluctant to get yourself and you may be a little bit worried, but you do it for the sake of your community, so we can get a handle of this disease.
Absolutely.
So as a scientist, talk about just a vaccine itself, how it eradicates disease. How you saw measles, you saw smallpox. Smallpox was last seen in where I'm from, Somalia.
Absolutely.
What I mean? I remember those pictures. When I was growing up as a child, I saw those pictures. So it is without a doubt, preventing a disease is 1,000,000 times better. So we are encouraging the community, please, for the sake of your health and your relatives and your community, let's vaccinate. As a Muslims, we should be 100% vaccinated. We should set model for the world, because that's what our religion teaches.
Mm-hmm. Absolutely, and really to fit this point is that some people would say, and it's unfortunate to hear this when they say, I'm going to get vaccinated. I'm not going to get vaccinated because enough people already got vaccinated. And this is never true. But we are, to be able to control a spread of the virus, you have to have the vast majority of people vaccinated, and we are not even close to that at this stage in the US. There are many countries that are actually doing much better than here. And there are, as Dr. Brahim said, as a community, you should think about doing your role, about really being vaccinated. If the more people vaccinated, the less chances the virus has to spread. And remember, it's all a chain. It's a chain effect. One person gets infected, that person is not sitting in the same place. That person is moving around. That person is visiting their family. That person is going to work. And that person is giving it to their kids, and their kids going to school. And it's a lot of chain that can stop by just one act, which is getting vaccinated in the beginning. And now that will stop the virus. And not only this is important to preserve lives, but also important to make sure that this pandemic ends. Because as long as we have variants, the pandemic will never end. Because that's a problem. I believe that the pandemic will end. I believe that we, as a population, we handled pandemics before. There was a flu pandemic 100 years ago that killed up to 50 million people. Again, we managed to control it. Or actually at this stage, there was no control, but it went through. And this one will go through. We are not going to live in a pandemic, but the price can be much less or less severe if we just follow the common sense of getting vaccinated. And this is my last slide, actually. This is what I really, the main message that I wanted to people to realize, that this is not the time to think about oneself. It's a time to think about what I can do to help out.
Yeah, and also really, it's always good to look back, hindsight, and I said, this is right now, we are in the history. We are in pandemic. The people of our world are going to look back and say how we participated. We do not want to be on the wrong side of history. We do not want to say, find out like 50 years from now, 20 years from now, okay? Those who took the vaccine and did not take the vaccine prolonged the disease, and it becomes, so we want to do what's right, even if it's a little bit scary sometimes, even if it's not uncertain, okay? But we need to do what is right. And we are teaching our kids, what does it mean to be brave? What is the definition of brave? You do what's right, even if you are a little bit fearful, a little bit anxious, right? So this is why I'm encouraging those, our community who is reluctant about vaccinations, is that you're hearing about scientists, Brother Ali, Dr. Ali, you're hearing from the physicians, you're hearing from people who think like that the vaccine is safe, it is effective, it's going to allow us to control this disease, it's going to prevent your health and your family members' health. I took the vaccine January and December when it came out first. Now we are counting 10 months. People say that you're going to die in 2 months. We haven't died yet. I vaccinated everybody in my family that was eligible. Inshallah, I'm hoping my 80-year-old will be eligible soon.
Dr. Ali, we here in Memphis, all the Islamic centers decided a few months ago, we ran a survey in all the masajid. And in this survey, we asked people to tell us, anonymous, this is anonymous survey, no names, just anonymous, to tell us if they had COVID and if they have took the first dose or the second dose. And to our surprise, Dr. Ali, 70% of the Muslim community in Memphis have taken at least one dose, or not two, if not two. So 70% of our community were immunized, and 10% were infected and recovered from the virus. So about 80% total had some immunity against the disease.
So we are hoping that by now, hopefully we need to repeat that survey. Hopefully we are hoping there's about 100%, and maybe it was 95, and inshallah after this talk, maybe it will be 100%, inshallah.
It's important to take the full dose, the 2 doses of the, if you're talking about the RNA vaccine, it's important to take the second dose for people who didn't take the second dose. It's remember, it's all about building your first line of defense, and 1 dose by data showed that it's really not as efficient or not as effective as 2 doses, because you basically amplify you make your own wall of preventing the virus, your own personal wall, much higher and much stronger by adding the second dose. So it's important to take the second dose. It's not going to make you have something that you didn't have from the first dose. It's not like to make you sick or anything. We know that there are some side effects that can happen, but those are only disappear within a day or 2. All the pain, the shoulder pain or anything related. So it's really important to take the full dose.
Dr. Ali, if you can expand 2 points that probably you mentioned earlier. Number 1, people get the virus or infection at one point in this pandemic. What is the advantage of them taking the vaccine? Number 1. Number 2, can you address, I know the FDA has not approved it yet, but can you talk about people who had one part of one vaccine, can they take the other one? Or let's say if they have a JJ1, they can take the mRNA vaccine, and can you?
So for people who had, lucky, who actually got the first infection and it was a mild enough that they managed to recover from it, we call those individuals are the elites if they take the vaccines, because all the data so far, the effectiveness of protection against protection, show that these individuals who got infected and got 2 doses of the vaccine do much better than any other category of people, because they are building on first the immune memory that they got from the infection, and now adding vaccination to that, they build a very strong barrier against any infection. Yes, there will be cases where you hear about someone got vaccinated and got infected, and that's what I described by breakthrough. But people who are infected and then got vaccinated, I can tell you that there are very, very few of those individuals who got infected again. But you do hear that people got infected and get infected again, but you wouldn't hear much about people infected, vaccinated, and got infected again. So why this is important? You really want to basically take advantage of the memory that you made, the immune memory that you made from the infection. And the other thing that to put in, to take in consideration here is that not every single one of us, even if the people who got infected, not every single one of the people who got infected will have a similar level of immunity. Some people, for reasons that we don't really understand yet, or some people for obvious reasons, will have a very weak immune system to their infection. And those individuals, unfortunately, will always need the vaccination. So don't take it as for granted that, oh, I got the infection before, I don't need the vaccination. You don't know how much immunity you generated by the infection. It could be for some medications you were taking at the same time, and many people taking other medications that don't think about it. And those medications could have impact on your ability of your immune system to develop a very robust protection. And that's the issue, that you should realize that why not, again, take the advantage of your own memory that you made. If it's a small amount that you made, small number of memory cells that you made, you can greatly amplify this in a very safe way with vaccination. So again, why take the risk?
Thank you so much. I mean, what a great advice you just shared with us, Dr. Ali. In these final moments of our webinar today, we want to invite you to give us a special advice. What special advice do you have to our brothers and sisters here in Memphis? And our viewers, if they're watching us also.
So I would say that this is an event that for most of us here will be once in a lifetime. This is a once in a lifetime, unless you were just born. This is once in a lifetime event. We will, 20, 30 years from now, for those of us who are still around, will remember that these are the days of the pandemic. And we will tell our grandkids that these are the days of the pandemic. And we will tell them how we handled this pandemic. And I hope that everyone will follow the common sense and realize that I hope that at that time you will be able to tell our own children and grandchildren that we did the right thing, and that's how we ended the pandemic. Hopefully, none of us will see this again, and very unlikely that we'll see something like this again. But our grandchildren might, because pandemic happened, and we just have to be ready. And science is leading us to a way to quickly respond to pandemics like this in the future.
Jazakallah khair. We thank you so much. On behalf of the Islamic Association of Greater Memphis and the Memphis Islamic Center, myself and Dr. Brahim Sultan Ali, we want to thank you so much for visiting us, for talking with us, and for sharing with us your knowledge. May Allah bless you, and we wish you a bright future, inshallah. Jazakumullahu khairan.
Jazakumullah. Thank you very much for this really beautiful invitation. It's always a pleasure to be back in Memphis.
Dr. Brahim, your final word, please.
Thank you, Dr. Ali, and thank you, Dr. Al-Mazin, for spearheading this and educating our community. And we are appealing to our community. Please listen to the efforts, Dr. Ali, and making it. They're making a significant contributions to controlling this disease, educating our community in Muslim community and in greater communities, basically educating the whole nation right now and elevating. So we are really, really proud of you. And we ask Allah subhanahu wa ta'ala
can do anything to put blessing and barakah in your knowledge, and you're sharing a beneficial knowledge. And may Allah have, accept it for you. And we are really, really grateful our collaborations with our community and Dr. Hassan Muazzin and IGM. We thank you, and we thank you for joining us tonight and taking your time and to please spread the word. Please, if you are vaccinated, but you know somebody who is not vaccinated, your friend, your cousin, please be advocate for khair, and let us elevate our community. Let us move this, and let's set an example for our greater community, and say, we want to do the next survey again and say, Muslim community, greater Memphis community is 100% vaccinated. I want to say that, and I want to shout it in the neighborhood, and we want to set an example. So please, we're asking you, help us and help yourself and help our community and help our greater community control this disease. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum
Alaikum assalam. Jazakum Allah.